A tracheostomy tube is an artificial airway which bypasses a person's upper airway. The tracheostomy tube is inserted directly into the trachea via a surgically created hole called a stoma. A tracheostomy tube can be either cuffed or uncuffed. A cuffed tracheostomy tube has a balloon-like feature at the distal end of the tube. The balloon can be inflated or deflated. When the cuff is inflated, all the inhaled and exhaled air enters and leaves the respiratory tract via the tracheostomy tube. A common question many people have is, when do I need to deflate the cuff on the tracheostomy tube? Join me this week as I answer that question. The cuff on the tracheostomy tube should be deflated at least once a day. Secretions from the airway can collect on top of the cuff. If the cuff is not deflated on a regular basis, these secretions can become a breeding ground for bacteria. This may lead to infection. If the person is prone to aspiration, when deflating the cuff, immediately suction the airway to get rid of any potentially harmful material which may have been aspirated. Additionally, the tracheostomy tube cuff exhibits pressure on the tracheal wall. The cuff should be deflated daily to ensure blood flow is maintained to the area where the cuff is pushing on the tracheal wall. If the cuff is not deflated, the trachea may suffer a lack of blood flow called ischemia. The mucosa lining the trachea may erode, and the tracheal cartilage may soften, which may cause the trachea to collapse. This is called tracheal stenosis. Consult with your medical provider to ask how long the cuff on the tracheostomy tube should be deflated and how often. In order to speak with a cuff on a tracheostomy tube, the cuff needs to be deflated. When the cuff is inflated, all air is directed in and out of the airway via the tracheostomy tube. No air passes through the vocal cords. Deflating the cuff allows for some air to escape around the tracheostomy tube and through the upper airway. As the air passes through the vocal cords, speech can be produced. If a person is using a speaking valve, the cuff must be deflated. Please never use a speaking valve with the tracheostomy tube cuff inflated. Doing so will prevent the person from being able to breathe out, and it may kill the person. In order to swallow, the cuff on the tracheostomy tube should be deflated. When a person normally swallows, the esophagus enlarges to allow food to pass down the throat and into the stomach. However, when the cuff on the tracheostomy tube is inflated, it pushes on the esophagus. This will prevent the esophagus from expanding. Food will get stuck in the throat. This may cause gagging and aspiration of the material into the lungs. To safely swallow with a cuffed tracheostomy tube, please deflate the cuff. A deflated cuff will not impede swallowing and will allow food to pass safely through the esophagus and into the stomach. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.